Senhoras e senhores, boa tarde. Sejam todos muito bem-vindos ao terceiro dia de trabalho do terceiro Encontro Brasileiro de Proteção Eletromagnética, com o tema As Radiações Eletromagnéticas e o Cuidado com Nossas Crianças. Este evento é organizado pela Rede Brasil pela Tecnologia Segura, EMF Brasil, Celular e Saúde e Ionize Brasil, com apoio do Ministério Público do Distrito Federal e Territórios, Instituto Federal do Rio Grande do Sul, Amibras, Associação de Medicina Integrativa do Brasil, Abrampa, Associação Brasileira dos Membros do Ministério Público de Meio Ambiente, Rede Latino-Americana de Ministério Público Ambiental, Escola Pan-Americana para Estudo e Tratamento da Dor, Academia Ibero-Americana de Medicina Biológica e Odontoestomatologia, FUNAM, Fundação para a Defesa do Meio Ambiente, Bemer Brasil, Angevan Ozonomatic, HealthTech Laboratório, Lemos Laboratório, Rede Latino-Americana por la Tecnologia Segura, Latam XTS e campanha Slow Phone. O primeiro tema a ser discutido hoje é Movimentos Internacionais de Proteção Eletromagnética. Nossa mediadora é a Daniela Perlato, advogada em Direito Ambiental e presidente do EMF Brasil, que a partir de agora tem a palavra para apresentar os painelistas convidados e coordenar os trabalhos.
Boa tarde a todos os espectadores do terceiro Encontro de Proteção Eletromagnética Brasileiro. Eu sou a Daniela Perlato, advogada ambiental e presidente da IMF Brasil. Nosso comitê dá as boas-vindas à doutora Stella Michaelidou, presidente da Comissão Nacional de Cyprus, Ambiente e Saúde da Criança, e perita da Comissão Europeia e da Organização Mundial de Saúde em Riscos em Saúde Ambiental. Damos a boa-vinda à doutora Erica Mallory Blythe, fundadora do FIRE, Iniciativa de Médicos para Radiação e Meio Ambiente, médica com mais de 10 anos de experiência no Reino Unido, membro honorário da Sociedade Britânica de Medicina Ecológica, médica conselheira na Associação de Radiofrequência Científica da Oceania e da Eletrosensibilidade Britânica, membro das regulações internacionais sobre radiações não ionizantes. Boas-vindas também ao doutor Ronald Melnick, ex-toxicologista sênior do Programa Nacional dos Estados Unidos, por mais de 28 anos no Instituto Nacional de Saúde e Ciências Ambientais, autor de revisões científicas para a Organização Mundial de Saúde, da pesquisa sobre o câncer, que classifica as radiofrequências possivelmente carcinogênicas. Passou um ano no escritório de Ciências Políticas Tecnológicas da Casa Branca e é colega emérito do Instituto Ramazzini, na Itália. Boas-vindas também a Theodora Scarrato, diretora executiva do Environment Health Trust, junto com a doutora Deborah Davis, epidemiologista e toxicologista, fundadora e presidente da Environmental Health Trust, ex-ministra do governo Meio Ambiente do governo Clinton nos Estados Unidos e que infelizmente teve um imprevisto e não poderá estar presente no nosso encontro. It is an honor to have all of you serious expert professionals on this path to inform citizens of the world about the risks of radio frequencies. Welcome to our panel, and I'll give you the word to Dr. Stella from now on. Please, Dr. Stella, welcome.
Good afternoon, everybody. Again, I have to say that it's a real honor for me to be in this very interesting conference. Many thanks to the organizers for the kind invitation, and especially Sylvia and Alina for all the support they gave to materialize this. And so my intervention today will be a sort of continuation of what I have told in the first day. And I think the speakers after me also show clearly that here we have a very big problem, we have a very high risk, with a lot of implications on children's health, in particular, not only now but in their whole life later on. And especially, I am very much concerned about the impact on the developing brain of the children. But also we know that we have a big problem today because there is a controversy of ideas. The governments are not willing to take measures. And we have the INCRIP and WHO and all these who claim that the only problem is thermic effects, but we know very well that we have biological effects. So the question is what we can do to this, to protect our children, at least to minimize the exposure. Either we have to stand by and waiting the governments to do things, or we have to do something ourselves. And this is what, as a Cyprus National Committee on Children's Environment and Health, have as a mandate. So please, could I have the first slide, please? So as a committee, we are committed to contribute towards minimize the exposure of the children via raising awareness, via education, and of course we try also within our terms of reference, which is set by the government, and we have a real advisory role. So we try to influence also the policy makers. In particular, we try to influence the parliament, which in Cyprus has the great power, but also we advise the Minister of Health and other ministries in relation to this issue. The next slide, please. Can I have the next? Yes. So, as I said, it's a very difficult task, because we have the higher obstacle, to my opinion, the highest obstacle is the position of the European Union, is the position of WHO, and all these that are claiming that there is no problem, in simple words. So the governments are taking into consideration those positions, and they are not very, very willing to do something. So we try to push at the policy level, and we try to explain that, yes, here is a case where we have to implement precautionary principle, because precautionary principle said exact that it should be implemented when we don't have the absolute proof of the problem, which is the case so far. I mean, we don't have absolute proof yet, but we have strong evidence, and the impact on health are very serious. So we have to combine the science that we have now with precautionary principle. And this is the main argument that we provide at the Parliament and also at the Ministry of Health. The second, and we managed at least in 2017 to halt the big project was about to Wi-Fi every school in Cyprus. So we halt this project, we stopped this project, and we had a decree on the behalf of the Ministry of Education, which prohibits Wi-Fi at nurseries and public elementary schools. It was one step which is, I consider, very important, at least. In the same year, we have a Nicosia Declaration in Cyprus, signed by the Vienna Austrian Medical Association, the Medical Association of Cyprus, and our committee, where we raise all the issues. Everything is on our website, on the English version. You may see all the documents. So in this declaration, we raise up the issue of need to make new standards which are relevant to the biological effects, which will be relevant to the real exposure which we face now, and not minutes of exposure as it is provided in the INCRIP limits, etc., etc. We raise the issue that we need to take precautionary action, protective measures at schools, at hospitals, etc., etc. The one very important thing from my experience, which I would like to share with you, is that try in your country to have a good cooperation with the medical community, the doctor community, the medical association, pediatric association. We are fortunate that in our committee, both the medical association and pediatric association are represented. And all our activities, I mean, especially at the policy level, are signed by those organizations along with the national committee. So this creates a very dynamic situation where it's not that easy to say, oh, this is not so important, is a committee says so. It's not only the committee, but it's the medical community in the country. So this is something which you can invent. And of course, we pay a lot of attention in training professionals like doctors and teachers. We participate usually in the annual seminar of the Medical Association, of the Pediatric Association. And also we make special training courses. This year and the previous year, we are going to train all the teachers in the kindergarten, because we consider that it's quite important to start from that level, the education of the children. And we believe that the children can be empowered. We have the experience with another campaign that we make for the passive smoking some years ago, before we have law prohibiting prohibiting the ETS. So before that, we had a campaign and we trained the small kids at the elementary school, and it was fantastic how the kids demand from their parents not to smoke in the house, not to do something which is bad for their health. So we put a lot of emphasis on training of the teachers in the kindergarten, and to provide for them material which can be used at the kindergarten. And one example is the video that you are going to see at the end of this presentation, which intends actually to make the kids sensitive enough to understand that the telephone are not a toys, that the digital devices are not a toys for them, and when and how they can be used by them. So, and we have also another intervention at the Parliament during 2019, 2 interventions in relation to the discussion on 5G. I presented in first day what we have proposed to the Parliament, together with the Medical Association of Cyprus. I can repeat it if you allow me. First of all, we ask to ban the use of wireless internet and wireless devices in all schools for children up to age of 15, to establish free from 5G protective zones around schools, playground, nurseries, and hospitals. Third, to promote biological safe criteria in assessing the exposure of children as an intermediate measure to the change of limits, which will take time and is very difficult to be decided, at least. And the fourth, we propose that the right to know for the citizens should be supported, and this can only be done by raising awareness, and that the responsibility for this campaign should be to the responsible for this campaign should be the medical association and our committee, so that we provide the people science-based, good information and good practices on how they can be protected. These were some of our activities. Can I have the next slide, please? The next, yes. Oh, the previous one, please. Sylvia, this one. As you understand, it's a very difficult task, and we use a lot of media actions and tools to achieve our target. And I would like to express my sincere thanks to Deborah Davis and Theodora and the Environmental Health Trust for all the support and the material they provide to us, and to the Baby Safe Project. As you can see, we issue a lot of leaflets, guidance leaflets in relation to radiation. We do seminar and training courses. We interviewed by TV in Cyprus, and some programs we provide information to the people on how to deal with this issue, what is the science behind, and what we need to do to protect the children. This year we have a series of podcasts under the umbrella of Child Shield. One of the aspects is related to the protection from non-ionizing radiation. And we have also a big campaign promoting the wired connection of the wired internet connection instead of Wi-Fi, especially for children during the COVID period, where they spend a lot of time in home doing distance learning. So we had this guide on safe internet connection. Next slide, please. Here is our campaign, travels on buses around Cyprus and says, don't irradiate me, learn how to protect me. This was the message on the buses. The next slide, please. Here is part of our small pilot project in Makarios Pediatric Hospital, where we managed at least to reduce exposure in the intensive care unit and in the unit of the preterm kids by disconnecting Wi-Fi and provide wired internets, any wired internets, and advise the people not to use their mobile phones, not approaching the beds of the children with their mobile phones unless it is on flight mode. And we teach also the parents there with various material that we provide to them, that they can hear music, they can take photos, they can make videos, but all this has to be done under flight mode to protect the children. The next slide, please. Here is our campaign of 2022-2023, with the aim to protect the fetus. In Cyprus, we have the Center of Preventive Medicine, Amerikos Argyriou, where all the newborn kids are brought for a preliminary control. So we cooperate with this and with Makarios Hospital and the Medical Association, and we distribute a package for all the new mothers which are visiting this center. We use the Baby Safe booklet. We get the kind permission to translate it also in Greek language, and we are very grateful for that. We distribute also our book, which is only in Greek, but provides a lot of information regarding many toxic factors which are in home, including environmental tobacco smoke, including pesticides, etc. This is a booklet having everything which a mother should know. Here is the risk, what can I do? And also we make some, in this year, we are going to make some presentation to pregnant women at Makarios Hospital. And also we have a video for pregnant women. This is our campaign. The next slides, please. This is ongoing. And now we are going to launch a new campaign in 2023, named Shields for Protecting Our Children from Toxic Factor, which is under the auspices of the Minister of Health, which is very important. We had a meeting with him and we discussed, and he decided to put it under his auspices, this campaign. And it has three targets. The first one is safe and age-related exploitation of technology, which is a big problem now, because we know that those digital devices are provided to infants, to babies, to small kids, to everyone. So we want the people to be educated, and of course, in this we include the aspects of how to use safe those technologies with wired internet, with flight modes, etc. The second is related to the tobacco smoke, which is not only the tobacco, the classical tobacco, but we have also the e-cigarettes, which is a big problem now because the people consider that is safe for everybody. That is not a problem, which is not the case. And the last, which will be done at the end of the year, is in relation to climate change and the child health. This is our new campaign. Next slide, please. And about our videos are provided, any country can use them if they like. If they ask us, we give the permission to do so under certain conditions without any money involved, of course. It's free of charge, but we need to have some provisions. So we can provide those videos without any subtitles, and then they can, each country can put subtitles in their own language, and we have already translated in English, French, German, Estonian, Hebrew, Swedish, Czech, etc. And our videos have been adopted by the Austrian Medical Association. The German version is under their auspices, and we are very honored with this. We go to the next slide, please. Next slide, please.
Dr. Stella, this is the last slide.
The last, okay. This is. I think I had something else, but I forgot to put it on the slide. But nevertheless, what I wanted to say is that there are a lot of things that we can do. We don't have to wait from the governments to take the initiative, because this would be very slowly, particularly as member of European Union. Cyprus is a member. We can expect our government to do anything which is not made at the European Union level. But we discuss at the Ministry of Health, and we propose that at least for the evaluation of the exposure of the children, we should use the biological relevant criteria, which we have, and that we should take any possible measure to reduce the exposure. This is the issue. And what we tell always to parents is that it's in your hands to do something, because the children, depending on their age, they spend 60 to 90% of their time in home and in school. Even those two places, we try to minimize the exposure by using, for instance, wired internet, by using in home less devices. We don't use Wi-Fi in home. We use less devices. We explain to them that if you use, the more devices you are using, the more exposure you have in your home. And it's not only the antennas, which is outside, but it's what and how you work in your home. And here is your decision to do something. So this is our approach, and I would like to thank you for your kind attention. Thank you very much. Can we see now the video, please?
Τα νηπιαγωγεία, όαση προστασίας των παιδιών από την ακτινοβολία των κινητών τηλεφώνων, tablets και του Wi-Fi. Μαθαίνουμε τα παιδιά μας πώς να προστατεύονται. Αγαπημένα μου παιδιά, γιατροί και άλλοι επιστήμονες σε όλο τον κόσμο μας προειδοποιούν ότι η ακτινοβολία που εκπέμπουν τα κινητά, τα tablets και το Wi-Fi είναι βλαβερή. Μπορεί να βλάψει την υγεία και ιδιαίτερα το κεφαλάκι μας. Την ακτινοβολία δεν τη βλέπουμε γιατί μοιάζει με αόρατες φλογίτσες. Εσείς τα παιδιά είστε πολύ ευαίσθητα στην ακτινοβολία. Πώς να προφυλασσόμαστε?
Όμως, κυρία, μετά πώς δεν μπορούμε μέσω τάμπλετ ή στο κινητό να δούμε τις φωτογραφίες και το βίντεο της γιορτούλας μας? Ξέρετε, η μαμά μου το θυμίζει.
Μαριλένη μου, το τάμπλετ δεν είναι παιχνίδια. Τα παιδάκια δεν θα πρέπει να το χρησιμοποιούν ούτε ακόμη σαν τηλέφωνο. Και ξέρετε γιατί? Γιατί βγάζουν αυτές τις αόρατες και πολύ βλαβερές φλογίτσες. Την ακτινοβολία δηλαδή. Τα καλά νέα είναι ότι μέσα στο κινητό και το τάμπλετ βρίσκεται κρυμμένος ένας πολύ καλός φίλος που μπορεί να μας προφυλάξει. Είναι ένα μαγικό αεροπλανάκι που όταν το ανάβεις μπαίνει σε λειτουργία πτήσης. Δηλαδή πετάει και παίρνει μακριά την ακτινοβολία, τις αόρατες και βλαβερές φλογίτσες. Μόνο το αεροπλανάκι μπορεί να μας προφυλάξει από αυτές.
Μα πού είναι αυτό το αεροπλανάκι να το ξεκινήσω?
Εδώ είναι.
Όλα αυτά τα κουμπάκια είναι φίλοι μας, να τα ανάψω?
Όχι, αυτά δεν είναι φίλοι μας, γι' αυτό τα έχω σβήσει. Θα πατήσουμε μόνο το αεροπλανάκι. Να θυμάστε, όταν παίρνετε το κινητό ή το τάμπλετ, μόνο το μαγικό αεροπλανάκι πρέπει να είναι. Όλα τα κουμπάκια πρέπει να είναι εσά.
Τι ωραία! Μπορούμε να δούμε φωτογραφίες, να ακούσουμε τραγουδάκια, μόνο παρέα με το φίλο μας το αεροπλανάκι που παίρνει μακριά τις βλαβερές φλογίτσες. Πότε χωρίς αυτό?
Μπράβο, παιδιά μου! Πολύ χαίρομαι που από εδώ και πέρα θα προσέχετε τον εαυτό σας. Σβήνοντας όλα τα κουμπάκια και ξεκινώντας το μαγικό αεροπλανάκι, διώχνετε την ακτινοβολία. Έτσι προφυλάσσετε όχι μόνο τον εαυτό σας, αλλά και τους γύρω σας. Είμαι πολύ περήφανη για εσάς.
Κυρία, στο σπίτι βλέπουμε και από το λάπτοπ βίντεο. Έχει και αυτό βλαβερές φλογίτσες.
Ναι, αν είναι ενωμένο με το Wi-Fi. Όμως, παιδάκια μου, υπάρχει και εκεί ένας πολύ καλός φίλος. Ο Ether, το αλογάκι, ή αλλιώς Ethernet. Είναι και αυτό πολύ γρήγορο και συνεταιράκι με το αεροπλανάκι. Ο Ether είναι ένα μικρό καλωδιάκι που ενώνει απευθείας το λάπτοπ με το διαδίκτυο, χωρίς να χρειάζεται το Wi-Fi με τις επικίνδυνες φλογίτσες. Σβήνουμε το κουμπάκι του Wi-Fi και είμαστε αλείς με γρήγορο διαδίκτυο. Η μανούλα και ο μπαμπάκας μπορεί να μάθει πώς να ενώνει καλωδιάκι Ethernet στην ιστοσελίδα www.pedi.com.cy.
Εμείς μάθαμε να προστατεύουμε τον εαυτό μας από την επικίνδυνη ακτινοβολία με τις βλαβερές φλογίτσες. Είναι εύκολο και μπορείτε κι εσείς. Φωνάζουμε τους φίλους μας το αεροπλανάκι, το συνεταιράκι του, το Ether, το αλογάκι και αυτά κρατούν μακριά από εμάς την ακτινοβολία. Αγαπημένοι μας γονείς, ζητούμε και τη δική σας βοήθεια για να ζούμε και να μεγαλώνουμε και στο σπίτι και σε ένα ασφαλές περιβάλλον χωρίς αχρίαστη ακτινοβολία. Η υγεία είναι δικαίωμα, μη μας το στερείτε.
Μετατρέπουμε το στο νηπιαγωγείο, στο σπίτι, σε όαση προστασίας των παιδιών από την ακτινοβολία. Τα παιδιά μαθαίνουν να αξιοποιούν την τεχνολογία με ασφάλεια.
Να σου το δείξω που να τελειώσουμε. So this was our video. And it's the first time that is presented. I mean, it's the first...
Is this the first time?
It's the first time, yes. So you honor your seminar with this, yes. It just finished.
Thank you very much for the inauguration here on our channel. That's very nice.
Thank you.
So,
thank you.